to all, just let me know in the comment box if my video is visible to all. I want to play a video of how to take a correct jaw relation. Just let me know if my video is visible in the comment box. So this is that we have already placed the implants and now we want to take the correct jaw relation. So one of the most important thing of taking a correct jaw relation is to first temper the wax properly. Now, a lot of us people I have seen, they still use the gas torch, which is not the ideal way of tempering or making the wax soft. So I strongly recommend. So it may sound very silly when I say all these things. But it is strongly recommended to use hot water for making the wax soft and then create some kind of a wax rim. The technique I'm showing you live right now. So just pay attention. Okay, it's very, very important. It's very, very important to temper this molding wax nicely, keep it soft and create a wax rim like the way with the technique I'm showing you right now. Yes, Dr. Ankur, I will answer all those queries, but right now I request all of you to pay importance to the jaw relation technique which I'm showing you right now. So now the trick over here is to adapt this wax rim buccally and palatally, creating like a upper arch in the patient's mouth. So as you see here, this wax is getting adapted buccally and palatally. So I am showing you the two rim technique right now. A lot of the people I've seen, they just put a molding wax and ask the patient to bite. But what I'm showing you is a unique two rim technique with which we are first creating the upper wax rim using a Fox plate, which we commonly use for the complete denture, making the posterior part of the rim parallel to the FH plane, and also creating a lip line simultaneously. So your lip profile should be roughly 2 to 3 millimeters. 2 to 3 millimeters. It should be roughly 2 to 3 millimeters below your lip, and your FH plane should go parallel to your ala tragus line. How many of you are understanding so far? Just let me know. Are you with me? This is where it will get more interesting. Just type yes in the comment box, please. So then we can move ahead. Yeah. So what we are doing is we have tempered the modeling wax and we are creating an upper wax rim with which the wax rim has got adapted around the implants. Okay, it has got adapted around the implants. We have created a wax rim around the implants, adapted it in a way that your rim is 3 to 4 millimeters below your lip line and the posterior part of your rim is parallel to your ala tragus line, for what we are using the Fox plate. Is it clear so far? Just let me know. Next, what we are going to do. Here, so you see here that the wax rim is 3 to 4 millimeter below the lip line, giving the lab an indication of the smile line. Next, what we are going to do is take another wax rim, soften it, and record the centric relation. Now, one of the best ways or the master technique of recording the centric relation is to put your wax rim in the upper jaw. Right? Never we put the wax rim in the lower jaw, as you see here right now. Okay, we keep it in the upper jaw, and this allows me. थोड़ा ऊपर देखना है, रिलैक्स, थोड़ा ऊपर देखना है, धीरे धीरे बंद कीजिए, टूक अंदर लेके. दिस अलाउज मी टू विजुअलाइज. धीरे धीरे बंद कीजिए, धीरे धीरे बंद कीजिए. हाँ, बंद. See this. When the wax rim, we have created the upper wax rim, and now your lower wax rim you are keeping in the upper jaw. This is the master trick. The moment you keep your lower wax rim in the upper jaw, you are visualizing the patient's jaw going into the centric. If you keep only one single wax rim, ask the patient to bite, you are not able to monitor the centric relation. But by keeping the lower wax rim in the upper jaw, it gives you complete control when the patient is going into the retrusion, giving you a proper centric relation. Plus, it allows you to ask the patient to stop to get the correct vertical. Just have a look. Can you see this? Okay, just type yes in the comment box and type bulb on if this was like a bulb on moment for you and you have never tried this before. Keeping the lower wax rim in the upper jaw. And now when you see carefully, you will be able to see the mandible going in the centric. कुछ नहीं करना, बस हो गया. खोलना भी नहीं, बंद भी नहीं करना. खोलना भी नहीं है, बंद भी नहीं करना है. He's not cooperating actually. तो मत जाओ चाचा, ऐसे कैसे काम होगा? मुंह खोलिए आगे. हाँ, बस बंद कीजिए. बस 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 हो गया. Okay, mold this wax rims as per the soft tissue profile. Next, what you're doing is with your steel scale, you are taking care that the vertical is recorded properly, which means from the corner of the eye to the corner of the lip equal to tip of nose to base of chin. This is called the rule of thirds. So with one technique, you have recorded the centric, you have recorded the aesthetic plane, you have recorded the FH plane, and you have recorded the vertical, all with one technique in less than 2 to 3 minutes. This is almost better than doing a Facebook transfer also, because the Facebook transfer just allows you to record the position of the maxilla to the skull. But here you are recording multiple orientations of a razor bridge, giving it to the lab, wherein he knows exactly your aesthetic plane, your FH plane, your vertical, and your centric. How many of you found this technique new and amazing? Just let me know. Were you recording the jaw relation like this? Even for your FMR cases, when you're doing crown and bridge work, you should keep your wax rim in the upper jaw and ask the patient to close. Yes, Dr. Jugal, you were among the lucky people to practice it with us during the residency program. So you know it. Great. Thank you, Dr. Imanshi. Thank you, Dr. Sandeep. Now, once this is done, you confirm the patient's vertical to corner of the lip is equal to base of nose to base of chin. That's your vertical. To check the centric, now this technique also, because we all know that this centric relation is a repeatable position in which the condyle is seated in the posterior superior most position and in a relaxed way where the muscles are all relaxed. It's a repeatable position. This technique allows you to repeatedly check your centric relation, which means you can no longer go wrong. Now, otherwise, a lot of times you will hear the lab person saying centric wrong hai, bite galat hai. But here, this technique will allow you to repeatedly check, as I show you in the video. See this. Now I'm checking again.
It's a repeatable position. Centric relation is a repeatable position.
So we recorded the centric. We recorded the centric. We recorded the vertical.
To the corner of the lid.
And now, after recording the vertical, we are rechecking if the centric is correct. So this technique allows you to repeatedly check the centric till you are confident about your jaw relation. See this.
This is a repeatable position.
Perfect.
Centric relation is a repeatable position. Okay.
How was this, guys? How many of you were taking the jaw relation? I think except for Dr. Jugal, who is learned it in the residency. How many of you were struggling with the jaw relation and now have found the amazing two-rim technique as a value add? And now you're sure that you can keep checking your centric relation as much as you want, get the perfect vertical, get the perfect FH plane.